Scott.
Yeah, and actually what Dr. Esper was just saying, and he made an earlier comment that I think emphasizes the same point. A lot of the decision making really does depend on the resources that are available. So if you are in a school that has poor indoor air quality, they don't have an up-to-date HVAC system, or has really large class sizes, or doesn't have school nurses, in the building or things like that, that makes it challenging. And so one of the things that we've been saying throughout this whole time, and it was really clear with the initial shutdown, and I think it's even more clear now, and that is that we have fundamental inequities in our system, and we need our state and national leaders, and especially right now, we need the Congress to act to provide resources to make sure that, recognizing what a lot of people are saying, that everything being equal, we'd rather have kids in school. We got to make sure that we have the resources to ensure that school districts have what they need to keep kids and staff safe. And so that's why we need the Senate to step up and act on a relief package. Again, addressing issues like air quality and PPE, also addressing issues like technology access, and making sure that everyone can count on high-speed Wi-Fi and internet access, and that there are technology devices that students have access to. All of those things are really critical. Unfortunately, we have national leadership that's saying, we're going to punish schools that don't open rather than providing schools what they need to open safely. And so the situation among all the districts, whether you're talking about Youngstown or Struthers or Boardman or Liberty, everybody is facing a little bit different kind of choice because resources are so inequitable right now.
Thank you, Scott. Carla?
Yeah, I definitely wanted to touch base on this. So in Liberty, and believe me, I want to be back in that classroom more than anything. Teaching online, honestly, I feel like I put in more time and effort just because we were thrown into it so fast. But the things that I'm concerned about with actually going into the physical classroom that I think, and you and I talked about this, you forget what it's like to be around 25, 7, and 8-year-olds. You remember what it was like in elementary school, but they're trying to Kobe it over into the trash can with their tissue. That tissue's now on the floor. They lost the pencil, they pick up one that they saw on the floor. We see those funny things on Facebook, them slingshotting the mask across the room. Like, it's going to happen. And honestly, it's, that's kids being kids, that's them socializing, sharing a book like, hey, look at this cool picture, or, wiping their boogers on their desk. That's what kids do. And my classroom is very small. I have one window, and last year I had 25 kids. There's no way I would even be able to space them out 3 feet apart. My biggest concern, and I would make it work, like whatever they tell me to do, I'll make it work to get those kids in the classroom. My concern is it is so developmentally inappropriate to have 25, 7 or 8-year-olds sitting at a desk for 7 hours straight in a day. This is what I'm hearing that they're saying we should do. Having their special teachers come in, like they're not allowed to, move from their seat. They stay in their seat. We sanitize every hour. I don't see how that would be at all enticing to a 7 or 8-year-old. I have gotten a lot of grants, so I have flexible seating in my room, and that helps with behavior and them moving, and the kids that may have a disability with ADHD or have other disabilities. I just don't see how that's possible without getting that additional funding, from the state. We also don't have air conditioning, which I know air conditioning, I heard, spreads the virus, but to think about my classroom, it literally sometimes is over 90 degrees in my classroom, and then us all wearing masks, or even just me wearing a mask. I don't know how I would do it. And I'm pretty healthy. I'm 35. But I know, my teachers, I teach with in 2nd grade. One's has diabetes, one has asthma. I'm concerned for their health. What if they become ill? We have a shortage of subs. So are their kids going to come with me? Who's going to watch those kids? I just don't know. I can't, I want them back in the classroom, but I wonder if it's just going to be, would it be better for us to start virtually and work this out while everybody's safe, rather than, let's figure out what happens as we go along, and then these kids have nobody. And I also heard something, I keep seeing things about these kids, where their outlet, maybe they're abused at home or not taken care of, or they don't have the food. I worry about those kids that if they were to get sick and from being exposed at school, and then they have nobody to take care of them, or what if their teacher gets sick and that's their only safe outlet, and they see their teacher sick, or their principal sick, or their recess monitor sick. There's just two sides to every story, and some days I'm like, oh, let's go back full force. If we get it. And then some days I'm like, I want to be safe. I want to be, go virtually. And I definitely see it from both ways. But I do know, as of right now, my school, and I love my school, and they do the best that they can, we don't have what we need to go back for us to be safe. If we were to go back 5 days a week, 25 kids in my class, I don't know how physically we could make that work safely, if that makes sense. And I'm sorry to ramble on and on about that, but that's just everything that I've been thinking about all summer.
Absolutely.
I'm so glad we have, a doctor here because I feel like I already feel better about the different school situations, hearing from a professional. Too many people are rambling on Facebook with their opinions, and I don't know what to believe, So I'm glad that we have a professional here. I'm glad that we have the representative from the teachers union as well. Because there's just a lot of things that I'm very confused and anxious about.
Dr. Esper?
Yeah, just to I can't go through everything that we just talked about, but just one thing, air conditioners are not necessarily a conduit for this particular virus. What is a conduit is poor airflow. And so if you're able to increase the flow of air in and out of the room, that's one of the best things that you could do. And I know that's things that the superintendents have been watching. I mean, I'm sure when they took the job of superintendent, they didn't think that they had to be an airflow and aerodynamics expert, but these are how our jobs change. But the answer is that the air conditioners itself does not distribute this particular virus. But if you have, as already mentioned, if it is poor airflow or poor HVAC system that doesn't allow for an airflow, then that can be a problem. Now, that may be as simple as you just make sure your windows are open and fans are blowing and things can work out that way. I'm oversimplifying things. I am also not an aerodynamics expert, so I'll leave that to Scott down below. But it's just one of those things. And to that point, as you said, there's a lot of misinformation out there. There's a lot of things that you read that people have read and have posted, and they don't necessarily follow the scrutiny. But it sounds plausible, and then people get worried about it, and these things have a tendency to augment online. But that's just one point that I wanted to make.
Dr. Esper, can you just mention if those face coverings, kids, I know I find it hard to have it on more than 10 minutes at work, and I'm an adult.
You should come to my job.
I can't imagine. I cannot imagine. Healthcare workers have done enormous, tremendous work in such a way that I feel humbled that I'm even doing what I do, because you guys are masked all day.
Yeah.
How about with kids?
With kids, it is it's a little tough. Obviously, I've been used to it, but I've been doing it for over 20 years. So, you kind of get used to it. But even then, even up to this point, we weren't wearing a mask continuously, 24/7 at least at the workplace. And so it's even we have to adapt ourselves here in medicine. However, for the most part, there's a couple of rules. First thing is that the masks do help. All right, we're seeing more and more information coming out about how well these masks do inhibit the virus to spread. As we talked about, certain individuals who have come into contact with people who are asymptomatic, right? They didn't know that they had that they were infected, and they do have the virus, but we don't necessarily know how well they spread, but it's possible that they can spread. And by wearing a face mask, even if you are one of those people who might be infected, but you're just not sick, it does help prevent the spread. It may, and this is more of the information right now that's coming out now, it may also help protect you from getting the infected. But the reason we wear the mask is to prevent us from unknowingly, unwittingly spreading the infection. But these cloth masks are were not designed to protect the wearer. It was designed to protect the individuals around the wearer. Now we're starting to see that there is some protection, not as good as those N95s and the surgical masks that we wear in the hospital, but if you only, if it's 50% protection, that's better than nothing. And so some of, wearing the masks do help. Now we do recommend, at least the Ohio, when you look at the Ohio recommendations, they do not recommend those in, I want to say ages in the 3rd grade or below from wearing the masks. The general rule of thumb certainly is if a child is too young to take a mask off, then they shouldn't have the mask on. Now, obviously, 2nd and 3rd graders probably are able to do that, but as I saw, the Ohio recommendations were for 3rd grade and above, I think should be wearing the masks, and those below should not. Certainly when you're exercising, it is not recommended that you wear the masks, all right? You need oxygen. There's a reason that we breathe. And that if you are exercising or in competition, you should not be wearing those masks. Obviously, when you're swimming, you should be not wearing these masks. So there are certain rules, but the masks do help. When you're talking about learning, when you're talking about being in a room or walking in a hallway, the recommendations both at the state, at the federal level, the recommendations are to wear these face coverings, and that from the science standpoint, they do help minimize the spread of this infection.
Thank you, Dr. Scott.
I just want to, and I know Ricky was waiting to jump in too, but one thing that I think would be helpful, because we do know that there are concerns about how hard is it going to be to have students adapt to wearing masks. I think this is where parents play an important role, that we're not waiting until the start of school before we start first modeling ourselves good mask wearing behavior. Anytime that we're out in public, that we're wearing masks wherever we happen to live in the state, whether we're in a red county or not. But also that we start getting our children in the habit of wearing masks as well. Let's try to minimize the spread before school starts, but let's also get kids used to wearing the mask so that if that's the expectation of school, teachers aren't dealing with that struggle because the kids are already used to it.
Ricky?
Just real quick, 2 things. One, so I have a 10-month-old baby and I have school-age children. I want to kind of ask, when should I quarantine the baby from the children? Because, at first I kept her home. She doesn't go to the store. I keep her kind of safe in a way, but she still plays with the kids because they don't really go anywhere. So when they start school or when they go out and do school activities, when should I kind of keep her separate? Because I feel like her immune system isn't as strong as theirs just yet. And the other question was, for children with asthma, I know asthma can develop. So I had sports-induced asthma when I was a kid, but it was only sports-induced. I only used an inhaler twice, I think, in my entire life. When do parents start checking for that? I'm asking. I have a 10-year-old, an 8-year-old, and a 10-month-old, and a 12-year-old who's not with me, but he's, I have these certain age children. When do I start to look for those things?
Doctor?
Yeah. Okay. First thing, when you have multiple kids in the family, when do you quarantine? And I would actually put this in kind of two levels. All right. For one thing, you cannot split up the family. All right. You should not be splitting up the family. In a family, you share many things. You share your culture, you share your food, and you share your germs. And unfortunately, that's just the way the families work. And when we see patients with coronavirus who actually have infection in coronavirus, it's a high degree of those people who are in the same household will also have an infection. They may not be sick, or they may even be asymptomatic, but they also generally have evidence that they were also affected as well. I would definitely say for the baby, in this particular situation, you know, the best time to keep the baby away is when one of the other children are actually sick. So just like we would with any other virus, all right? If they had strep or if they have pneumonia, which are very normal, or if they have the flu, and again, normal, but another virus, etc. You want to keep the other kids away from the person who's having the fever and the cough and, you know, maybe some chills, and you keep them apart from the rest of the family, and you designate someone to go in there, you know, one of the adults to go in there and assist the children that's sick and keep the other children away until that the sick child is better. But if, let's say, in the situation that one of your older children, somebody in their class was positive, and maybe then they're asking the class, the members of that class to stay home to watch because they were a contact. I wouldn't necessarily mean that that means that child who was a contact, not sick, but just a contact, has to then go into a full quarantine within the household itself. You may want to minimize. All right, you may not want to have direct contact to, you know, the baby, you know, being held or cared for by that particular individual. So that's a little bit less. But if they're not sick and they're not developing symptoms, I still think that you have to stay together as a family unit. And so that's kind of how I would play it. It's kind of a two-tier type system.
Carla and then Amy.
This kind of goes along for it, but I wanted to ask Scott, in the situation of my husband and I don't know if this, I don't know much about the union thing. I try not to, it's just, I don't know a lot about it, but say that he were to contract coronavirus at school and, you know, he has to stay home. And then doctor said, you know, if you're in close contact with the person with the virus, I would stay home, but my students probably wouldn't have to. Do you know right now where they're standing at with sick days? Like, do we use our sick days if we have the coronavirus, or is that going to be something separate? I keep hearing a lot of different things and I'm not sure.
So that's a good question, and there are a couple of different factors that will influence the answer. There is new federal law, the Families First Coronavirus Response Act, that does provide additional leave for people that, because of their exposure to the virus, you know, the opportunity for leave without being penalized by having to take your sick days. And we're lobbying for an extension of that in Congress right now. So that's kind of a first line of protection. But then depending on each of your school district contracts and what you have negotiated as far as sick leave and other kinds of leave, that's something that you know, we would support you as you work with your school district administration to see what the appropriate course of action would be on that.
Okay, thank you.
Yeah.
Thank you. It's good to know that you are pushing for that federal extension too, Scott.
Yes.
Thank you. Amy.
I kind of have two points I want to address. First is like towards the education aspect of it and for our educators. I just want to make sure that our educators know as parents that if we want to send our kids to school, it's not because we're trying to be selfish or we need babysitters or anything along those lines. It's more that, at least for me, I look at education as a science, and you know, that's what my child needs. They need that face-to-face, they need that relationship with their teacher, they need to have the interaction of asking questions in the moment that you're qualified to do. I look at you all as essential workers, as I would a nurse, a doctor, a person, you know, working outside of the home right now. So I just want to make sure that's very clear, that whatever somebody chooses, it's not to be selfish to a degree. It's to do what they think is best for their kid. That being said, I've worked with committees that work on school funding. So I'm, you know, a little bit concerned that schools are already underfunded. And, you know, now we have all of these things in place that, you know, they barely can cover the essentials. I've worked in the schools just to help with volunteering and whatnot. And the state really needs to step up to make sure that each school gets the proper funding to provide a safe environment for our children. So that was one point. The second point was more for the doctor. I've heard that they may test the kids for sports if they go back to sports for school before games and matches. To me, that seems like a waste of testing, and maybe I'm wrong, but I don't know if they can force it or not force it. But if you test on Monday and your match is on Tuesday, you don't even have your results till Wednesday, and you could have it by then. So I just don't know what the answer for that would be, if that seems like a waste of testing and we should just watch our symptoms and do what's best in the moment.